So what's up guys, so today we are going to learn about drug dosage forms of drugs, the physical state in which drugs exist. You'll all agree with me that matter in this universe exists in three forms, solids, liquids and gases, and so do drugs. Drugs we have solid formulations, drugs we have liquid formulations, drugs we have gaseous formulations. We use gases in therapeutics. Now to explain this, we take help of a simple drug like paracetamol, okay, analgesic antipyretic drug. Now this drug exists as tablets, which is a solid oral dosage formulation. This drug is available as a liquid formulation in the form of syrup. This drug is also available for injectable preparations. Injections of paracetamol are also available. So in other terms, the dosage forms of drugs have a relationship with the route of administration and vice versa. So you want to decide on route of administration, you should have the available dosage forms. If you have the available dosage forms, you can go forward and decide on a particular route of administration depending upon the clinical scenario. Now let's go to solid preparations of drugs or dosage forms of drugs, solid dosage forms of drugs. Now the logic says if you have solid, I need to swallow it or I need to take it through the GIT. I cannot inject a solid particle or a solid drug directly into my body through the veins or through the muscles or whatever it might be. So usually the solid dosage forms or solid dosage forms are available as solid oral dosage forms. So solid given orally dosage forms, and the first variety of that would be tablets. Now tablet is a compressed hard medication. So it's solid, it's compressed, and it's a medication. Okay, and most of us in our lifetime by now I think have taken one or the other tablet for common or serious illnesses. So it's most user friendly kind of a dosage forms that we know of. Now a tablet can be a normal uncoated tablet, a white tablet. In the place I stay, we have paracetamol tablet, that's an uncoated variety that's available. You have calcium tablets which are also uncoated in variety, and so on. On the other hand, you have the coated tablets. You place a coating around the tablet and then you call it as a coated tablet. Now that's basically done to make the tablet more visibly elegant, to add some flavor so that you mask the taste of the drug, you mask the smell of the powder. It also increases the shelf life of the drug. At the same time, it prevents the drug powder from getting in contact with the environment. So it's beneficial to coat a tablet, but it increases the manufacturing cost at the end of the day. There are certain tablets like multivitamin tablets which are available as coated tablets and which are usually prescribed to individuals. Okay, so it makes tablets more palatable so that they can be swallowed very easily as compared to the uncoated tablets. The next variety would be the chewable tablets. Okay, chewable tablets, examples would be tablets like antacids given for heartburn. So you have what's called as hurry, worry and curry. You all health professionals, you always have that hurry, worry and curry. So at the end of the day, you always tend to be on the side of getting acidity, gastritis, heartburn. So the most commonest tablet prescribed across the globe over the counter prescription, one of that would be the antacid tablet. So it's chewable. You just keep the tablet inside your mouth, chew it, and then you can swallow it or you can take it along with the water. Okay, so that's one variety of tablets that's available. The next in the line for tablets would be the sustained release preparations. So something which is sustainable in action. So the tablet releases the drug over a period of time. Now you want to have such a tablet for conditions, clinical conditions like cardiovascular events, patients with angina, patients with myocardial infarction. You want to prevent any further attacks. So you require what's called as the drug levels to be maintained for 24/7. So in that case, you need to have a sustained release preparation of tablet. This is just one clinical scenario. There are different clinical scenarios in which you require the drug to be there inside the body for the entire day. It also makes the tablet more user friendly. Okay, so you just take one tablet in the morning and forget it for the next 24 hours. So reduces the frequency and makes the tablet more user friendly kind of a thing. So calcium channel blocker tablets, in the place where I practice, we have those drugs which are sustained release preparations of these tablets. Then we have what's called as sublingual tablets. Okay, sublingual, you need to keep the tablet below the tongue. Faster way of absorption, avoids the first pass metabolism. We have nitrates, again rescue medications in cases of angina, myocardial infarction, cardiovascular events. So nitrates, very fast in action, just keep one tablet, gets absorbed and the work is done. So you have a sublingual variety of tablets also. Now apart from this, what we have is the capsule. Okay, so capsule is also a kind of oral dosage formulation. Okay, it's made up of gelatin. There are two varieties of capsules. Okay, you have something called as soft capsules and the hard capsules. The soft capsule will be having a liquid formulation inside it. So you have cod liver tablet, cod liver capsules. Okay, so those kind of things. Okay, so liquid preparations inside the capsule. It's made up of gelatin, the capsule, and it's biodegradable. On the other side, you have certain antibiotics, and then you have certain other multivitamin tablets. You have powders or granules, and then you pack it in capsule, and that's called as a hard gelatin capsule, which is slightly different from the soft gelatin capsule, and you can appreciate that onto the screen right now. So that is about capsules. Now apart from capsules and types of tablets, what we also have is powders. Okay, powders. So you are those bodybuilders. Definitely I am not the one, but you need to take those protein shakes, so protein water, protein in milk or whatever it might be. So you require those powders, and these are kind of medications at the end of the day. So you have those bulk powders in bottles, and you take 2-3 teaspoons of that and with milk or water and just keep the body up, building going up. Or in other terms, example would be ORS, oral rehydration solution. Life-saving medication in under 5 gastroenteritis, diarrhea, rotavirus diarrhea. You must have heard of these terminologies. So you have this ORS, that's oral rehydration solution powder. So that's basically available as single dose. You just need to cut open, add it to water, and just start giving it to the child with vomiting and diarrhea. So something on powders. Then we also have what's called as granules. So instead of powders, we have aggregates, small aggregates of these drug molecules, and that is what we call it as granules. Again, a lot of multivitamin, bodybuilding medications are available in the form of granules, and that's also quite often used, and we get all these medications mostly as over the liquid dosage prescriptions, liquid dosage forms of drugs. And the first variety of that would be a solution. Now a solution is a clear liquid entity, so it's clear, you can see across a solution. So the active ingredients, the drugs, are dissolved completely in a solution. Now that is what is a solution. Okay, you have an aqueous base, you have water in it, which acts as a vehicle in which most of the drug ingredients are dissolved. But if instead of water you add a sugar solution, then it becomes what we call it as a syrup. So syrup is 66% sugar solution. Okay, it's clear, and you have so many sugar solutions, sugar syrups available, cough cold syrups which are available, which are nice to taste because they are sweet, and they contain 1 or 2 active ingredients. So they might contain antihistaminic drugs to control allergies, they might contain antipyretic analgesic to control body pain and fever associated with cough and cold. So usually this cough cold mixtures is what is available as syrups, and they have a sugary base roughly the sugar content would be around 50% plus. So that's the range. 50 to 60% is what we are seeing when you look at syrups. But anyways, nowadays you also have sugar-free syrups for individuals who are suffering from high levels of sugar, diabetic individuals, and you don't want to infuse sugar in them through oral route. So try to give them some sugar-free syrups, and that's the newer variety that's available. With us, solutions can also be used for parenteral route. Okay, so you can have injectable preparations which are solutions, and you can use it for IV use, or you can use it for intramuscular route or any other route, preferred route in whatever conditions it might be. The next on the list of liquid formulations is an emulsion. Okay, emulsion. Emulsion is a kind of a two-phase system. So it is what we call it as oil in water kind of a system. So oil in water, it means oil is in lesser amount as compared to water. So oil molecules are dispersed, or droplets, sorry, are dispersed across in an aqueous medium. So emulsions are available in that form, and usually we have a lot of emulsions for kind of constipation and so on. We have emulsions that are being used in therapeutics. On the other side, emulsions can also be used for parenteral use. And the best example of that would be, drugs like anesthetic drugs like propofol. It's an emulsion. It's an emulsion, and that's used as a daycare anesthesia agent. So that is something on emulsions, oil in water kind of a homogeneous system. That is what we call it as. It's always opaque. It's not clear. Now the third variety of dosage liquid formulations would be the suspension. A suspension, the word itself, you suspend something into a vehicle. So if I try to add sand in water, it will be kind of a suspension. So you have active ingredient that is suspended in a vehicle. The vehicle usually is the aqueous medium. Okay, so you may have 2 or 3 active ingredients that are also suspended in a particular aqueous medium. Now what happens is that over a period of time, the suspended particles try to go down and sediment at the bottom of the bottle. So always remember to shake the bottle very well, so that the suspended particles again become suspended in this aqueous medium, and then they can be taken in. So something on that suspension. We have oral dosage formulations of suspension in the form of antibiotics. We have powders, and you need to mix water with it, and it's very clearly written, shake well before use. Not in other terms, but in medical terms. Okay, so that is all suspensions. You also have IV uses of suspension, and so many antibiotics are available as suspensions, and that have been used for IV drug or parenteral drug usage in general. So if that was about liquid formulations, now we go to another variety, that is topical applications. The word topical means you apply either on the skin or on the mucosa. So we start up with eye drops, ear drops, nasal drops, nasal sprays, or topical applications. You have so many varieties of these drops which are being used, and they are usually solutions to start with, in which the active drug ingredient is completely dissolved, and you use it for various infections, allergies, and so on. So a lot of drops, antibiotics, anti-allergic drops are available for eye, ear, and nose. The next in the line would be something on to the ointment. Okay, so ointment is something which is having a greasy base. It's oily in nature, and you have so many ointments. Okay, so ointments is like painkiller ointments are available. You need to apply it onto the skin, and it's only for external use and not something for internal use. Now going something onto cosmetic sides, we have the creams. Okay, the creams are of 2 types. One is what we call it as oil in water, and the second one is water in oil. Now if you're talking of oil in water, again oil in water, so oil is dispersed in the aqueous medium. So basically it's a kind of aqueous ointment, a lot of water content in it, and it's usually much more comfortable to have a watery ointment because it suits, it doesn't become so oily on the skin, and is basically good to deliver drugs via this route, as against what we have is water in oil creams. Oil is in more quantity and water is dispersed in the oil. So usually you have the moisturizer creams, you want to keep the skin moist, and you go for what's called as oil in water kind of creams. That's available. Now apart from that, we have something called as liniments, and examples would be the Sloan's liniment. I hope it's available across the globe. You also have what's called as tiger balms. Okay, it's much commoner in this part of Asia where I am staying. I don't know about the rest of the world, but liniments are supposed to be the ones which will be which are used often as kind of pain relieving medications. You need to apply the liniment onto the skin and rub it. So that's the difference. You need to rub the liniment, and it acts via counter irritant mechanism to wave off the pain associated with any kind of a strain or a sprain in the body. So that's about liniments. We also have some sprays. You go to sports medicine side, you have sprays of medications. So you get a painkiller drug, you just put one puff of spray onto the part which is affected, and you get relieved out of that pain. So even that is a kind of a dosage formulation that's topical in nature. Now apart from that, we have the gases, the gaseous variety of what we call it as dosage forms. We use gases for anesthesia. So we use humidified oxygen. The word humidified is important because that demarcates the normal oxygen from what we use it in biology or for human beings. So humidified oxygen. Then we have nitric oxide and so many other drugs which are given by inhalatory route. Directly the drug goes and reaches the lung, from the lung to the bloodstream, and from there to the required organs. CNS basically has action on that. The path of exit of the drug is also through the same way. So it exits through the respiratory system and so on. So gases are also a kind of what you call it as a dosage form. Apart from this, as we have what's called as the inhalatory route. So cases of bronchial asthma, breathlessness basically. You want to relieve breathlessness. The problem is with the lung. So why not just give the drugs to the lungs instead of giving drugs to the entire body? So the best way is that give drugs by inhalatory route. So keep a mask, give the drug in aerosol form, that is tiny minute particles of drug suspended in air, and just goes inside the lung, acts in the lung, and just gets the results, and it even gets out from the same way. So inhalatory way of action of these drugs. And we have one more dosage form with us. We use nebulizers, meter dose inhalers, spin inhalers, whatever you talk it of, you are talking in terms of inhalatory route, and a new dosage form is available for this kind of disease, this kind of conditions, and so on. And now we have some special delivery systems. Pessary, vaginal pessaries. The problem is within the vagina, white discharge, and antifungal medication. These are tablets which dissolve on their own. Just keep one of that within the vagina, and the action starts, and usually the relief is achieved. You have vaginal rings, IUCD devices, that is intrauterine devices, that are also helpful in contraception. They release drugs, hormonal drugs, and to help in contraception and so on. So I mean, technically these also come under various forms of dosage or dosage formulations that we must be considering. In addition to that, we have suppositories. Suppositories are basically for rectal administration of drugs, made up of glycerol, and it's oval shaped, semi-solid consistency. Just push one suppository inside for constipation, and it's the best way of relieving constipation. You can give medications via rectal route in the form of a suppository. Antipyretic drugs, that is drugs which decrease fever, or anticonvulsant drugs, especially pediatric age group. Enema is also kind of a dosage form in which soap, warm water mixed with soap is instilled within the rectum. You also have retention enemas for certain autoimmune diseases of the GIT, in which you try to push in water or the drug and keep it there for some time, and get relieved of whatever the person might be suffering from. So enemas is also a kind of dosage form of drugs that you should be aware of. Now this was in general about dosage forms. I hope you got whatever I wanted to say. Please keep watching my videos. Do subscribe. Thank you. Bye.